let's get to the big story this evening, and it continues to be and will in all possibility continue to be COVID-19 for the foreseeable future, because we are in the middle of a situation which is pretty painful. India has the highest number of daily cases. We've crossed the 1 lakh mark. The problem areas are now clear and known. Maharashtra, which is seeing the most number of cases, around 57,000 at last count, is putting in steps to try and reduce the spread of cases. The steps, unfortunately, is very close to what we saw exactly last year. We're not calling it a lockdown, but it sure feels like one in many, many ways. Restrictions have been put into place. All non-essential shops will be shut all throughout till the 30th of April. There are even more stringent restrictions over the weekends. The curfews are in place. Only essential establishments are allowed to be open, and travel will be restricted. What is different, though, that there is no restrictions on travel between states and within the state itself. So that has not kicked in yet, and that is different from what's happening last year. So as we look at what could come next, it is important to ask a few questions. For one, did we lose precious time with the slow pace of vaccination that kicked off in India on January 16th? It's important to ask this question. Today, we've crossed 8 crore vaccinations, which is great, but it seems like a drop in the ocean compared to the pace at which cases are spreading. Remember, we had a good amount of time in terms of the ability to vaccinate more people. We're one of the few lucky countries who have an ample supply of vaccinations because we're making our own vaccines as well. Did we miss that window of opportunity is a tough question that needs to be asked. We also need to ask why we're again facing shortages in medical infrastructure after a year. Remember that restrictions and lockdowns that you're seeing, of course, more in Maharashtra and other places as well, is so that medical infrastructure doesn't get overrun, so that hospital beds don't run out. We are seeing that situation already. So in the last 1 year, did we not learn enough in making sure we had sufficient medical infrastructure? And this does not just extend to the beds and the ventilators. We needed to have trained more people to deal with this. Did we lose out on learning those important lessons? Could we have found a better response to the spike in cases rather than a lockdown? The whole world knew that a second wave was coming. It's been well documented in history. Were we caught unawares once again, even despite knowing that this is a very clear and present danger and a possibility? So in short, did we really implement the lessons learned from the first wave well enough? Why do we find ourselves in this state of confusion and panic once again? To speak on some of these points, I'm joined today by Dr. Ramanan Laxminarayan. Dr. Suneela Garg is with us on the show, as is Dr. Velumani of Thyrocare. Welcome to all of you, and thank you for speaking with us. Dr. Velumani, I'm going to begin with you, because I want to get a sense from you what's happening on ground. We are now hearing that at least in Maharashtra, and I'm sure in other hotspots as well, there's now a waiting time to get RT-PCR tests because there is such a huge demand. Is this what you are also seeing?
Yeah, in this part of the country, Western India, especially Maharashtra, it is unfortunate that half of the countries infected are in Maharashtra, in that also in Mumbai a large portion. So there is a burden on laboratories in Mumbai and Maharashtra, but not to that extent somebody has to wait. I have a reason to believe that we are in the last 1 week doing a maximum possible, but anything more than that, there will be a waiting line. And as of today, I think all laboratories are functioning at their fullest capacity, and there is no pain of raw material reagent. But worry is, in the last 8 weeks, it has gone almost 5 times more. If it doesn't go more, we are safe. If it goes high, we may have to wait list.
Now, Dr. Velumani, you now have a situation where you have to test more and more. The new guidelines, at least in Maharashtra, talk about tests of RT-PCR tests every 15 days. More and more establishments want tests, frequently. to allow functioning to take place? Do we have the capacity?
Fortunately, in the month of January, what we were doing around 8,000 tests a day had come down to 2,000 tests a day. So in our business review meeting, we had given up. We don't need more capacity. Even existing capacity will go waste. What to do with the existing capacity? But in this last 8 weeks, the full capacity is utilized. And to build capacity, you need 30 days minimum, without which you can't build it. So if there is a pressure, capacity will be built. Man has learned, business has understood how to build capacities if there is a demand. But only worry is, once again, if it collapses, it requires a huge investment. So there is a risk for the laboratories even to expand the capacity. But we are all planning to put up more capacity.
Okay. Dr. Ramanan, I'd like your view on some of the questions I raised in the beginning of this discussion, which is, can we put down the current plight we find ourselves in simply to, hey, this is what happens in pandemics. There's always a second wave and it's a bigger one usually. Or is there a case to ask the question whether there has been a lack of governance or some misgovernance in the way we've prepared for this?
Right. So, Tamana, a second wave is, it does happen when you have a new virus hitting a completely susceptible population, and not everyone has been infected in the first round. So there's many people who are still susceptible. In this particular round, you find a lot of people who were not infected in that first round because they had stayed indoors during that first round. Now, that said, you have to remember a few things about the current wave. One is that it appears to be rising a lot more steeply because it is rising during a time when there was no lockdown, compared to 1 year ago when at 500 cases itself, we had a lockdown anticipating exactly this. So when people ask the question, was there a need for a lockdown last year? And the answer is, look at what is happening this year. This is only a fraction of what would have happened a year ago without a lockdown, when the entire population was susceptible to the virus. And I think we're seeing the value of those restrictions now. That said, as you correctly said, have we spent the year in preparing for the health infrastructure and the other infrastructure that's needed? I think to a large extent, yes. There was no PPE available a year ago. Today, it's available in significant quantity. There's the ability of the system to implement very localized shutdowns, which was not there last year, which is why you needed a national lockdown. The testing capacity today is vastly more than what it was a year ago, exactly the same time. And in fact, we're only paying attention to reported cases, but remember that reported cases are also a function of testing. And today we have a lot more testing than we had a year back. So I don't think you should worry too much about the levels of COVID at this point in time. They reflect the fact that, we have a lot more testing capacity that's available at this point in time. Now, did we utilize the time when cases were low to prepare for the next wave? We did not, and that's because that's just human nature. When people don't see a lot of COVID cases, then they become lax, people stop wearing masks, governments become more lax, and people think this is entirely in the rearview mirror. And of course, it's hard to predict what the variants will also do here, because the variants are the big unknown in this entire story. Although we know about the presence of variants, we really don't know a lot about what they are doing to the transmission of COVID during this wave. And everything that is being said about it is entirely speculative. We really don't have firm information here. So just to summarize, I think that this second wave was inevitable. It is hard to prevent a second wave. I don't necessarily think that this is a worse second wave than the first wave. We don't have any evidence of that sort. It just appears to be bigger because there's more testing at this point in time. But I also think that we're going to have to go through this a few more times in the way that the Europeans have gone through it, people in New York have gone through it. This is just inevitable because that's how the epidemic works.
Dr. Garg, is this just inevitable and do we have to go through more waves? Are you seeing any evidence of what is anecdotally being talked about, that this wave seems to be more virulent, as in it's spreading faster but perhaps not leading to as high as mortality rates?
Definitely. You see, the wave appears to be much more intense in nature in terms of spread of infections, because as has been mentioned by, also Ramanan, that, we are, seeing mutant strains as well, which are more infectious, but they're definitely not that serious in nature. That means we are having much less mortality. Today also, when I was reviewing the data of United States and Brazil and all, they have, lesser number of cases, but with more mortality. Whereas India has got mortality in hundreds, so that's where we are much better off in terms of, uh, our standard guidelines are there, and also the infection is much less severe in nature. That's one thing which we have to see, but there is no doubt about it that the virus will not go just like that. That there is a second wave and it will go away. We will see in spurts in different parts of the country, because you see, still there is a huge chunk of uninfected population. Let's say rural areas where we don't have any much information. For the first time, we didn't have any much information. Virus was not there. And also, now also we see that, like in few parts of Vidarbha and all, we got the infection, but we do not still have in all the districts of the country, across in rural as well as in urban slum areas. That is one thing which we have to keep in mind. And the third part, still I say that MTV part, which one has to remember, as part of leader of OMAG Association, that is Organized Medicine Academic Guild, which is a combination of 15 associations. We have used this as a punchline, that is masking, testing, treating, and vaccination. So that's where I still feel that mask is also a vaccine. And that is the thing which will protect us along with the vaccine. So these things have to be kept in mind. And one thing which you pointed out in the beginning, that you were very true, that earlier, you see, we could have done retrospectively, now you think of, we could have done much more number of vaccinations and all. But you see, when we start with the healthcare workers and all, who are more, knowledgeable, more thinking about the, areas, because they are usually involved.
But they didn't come forward. They
Yeah.
didn't, a lot of them didn't come forward. The fact is that a lot of healthcare workers didn't come forward.
Yeah,
Now
Tamanna,
they're coming
because-
forward. Now we have this hodgepodge situation where the government is stopping their registration because people are pretending to be healthcare workers desperate to get the vaccine.
No, but then you see what happens is quite a number of workers also, you see, basically are also involved themselves in trials, and they thought that usually in trials, it takes about 5 to 7 years. You see, nobody could expect that this vaccine will come so fast. So that there was huge hesitancy. But now you're absolutely right that people want to take the vaccine. You're right. So that is what is the missed opportunity or missed time, what we say at that point of time. And now you see, we are in a situation where we have to vaccinate people from general population, and now healthcare workers want to get the vaccine along with the frontline workers.
Dr. Velumani, logically I understand what is being said, and it sounds correct that second wave is seeming larger because there are lesser restrictions compared to when we first started hitting the peak. So the numbers really started climbing post July, if you will remember, when the restrictions were let loose a little in July 2020. We also have learnt our lessons in terms of PPE kits and a protocol of how to deal with COVID-19, etc. But then why is our medical infrastructure again running short? In your large cities, at least in Mumbai, I can vouch for this, there is a panic and a scramble for hospital beds, for ICUs. People don't know whether they will find the help if they need it. And that is a situation which definitely needs to be avoided after a year of having to deal with this.
In which the public at large has been communicated by media, by bureaucracies, thoda din baito ye virus mar jayega. That is kind of feeling we wanted to create. But when in February vaccination arrived, people felt vaccination may be high risk. It looks like virus is safe. In these last 8 weeks, people have understood, even the healthcare workers who even in our own laboratory many refused, now are very keen to get it done. So that's one aspect of it. I think healthcare infrastructure in this country has not improved because of COVID. We only have struggled. And probably I am not just telling probably, it is certainly, the infected have gone up, but not the number of deaths parallel. There is an uptick, but not parallel. So it looks like today we have a strain, if it is a different strain, which is fast infecting and least mortal, which says that a fair amount of control is still there. But having said that, the number of testing has gone up, percentage of positive in testing also has gone up. But let me tell you, कोई नहीं बच सकेगा. पूरा 1.35 billion population has to undergo an infection, not once, many times, because the virus is going to remain around. Vaccination will protect. Antibody, if it is there, it will protect. It will only protect from you from getting into serious medical complications. It will not protect from you from getting infected. So this is something which we have to learn and to be with. According to me, for next 5, 7, 10 years, this number of infections will continue to remain. We are quantifying number of flu, we don't quantify. Number of tuberculosis, we don't quantify. Number of COVID, we quantify. So in my personal opinion, this 200 plus death on COVID will be there not less than 5 years. This is how I see virus, which is likely to do harm to the country and to the society.
Wow, that's quite a sobering thought. If you're saying, to quote Dr. Velumani, koi nahi bach sakega, everyone's going to go through it. But like you said, the vaccination is what we have, right? To make sure that you don't have a severe disease and to quote unquote normalize this infection, like you have a host of other infections. Some people fall prey to it, some don't. Dr. Ramanan, let me come to the question of vaccination, and this is oft repeated, said several times, but look at the situation today. You have two chief ministers, Arvind Kejriwal and Uddhav Thackeray, who have written to the central government saying, let me vaccinate everyone. Arvind Kejriwal says, if I'm allowed, I'll vaccinate everyone in Delhi in 3 months. Uddhav Thackeray is asking for vaccination above the age of 25. Where do you think the hitch is now? Clearly, it's no longer a moral issue of who should get it first, who should not. Do we truly have enough vaccines? Have we prepared for a situation where we will need to bump up the number of vaccines much more? Which brings me to the question I asked in the beginning. Did we lose that window of opportunity?
So, Tamanna, I would say that I would not normalize COVID in the sense that it is very different from the flu. The mortality rate is higher. Long COVID is a thing, which is long-term effects. And we would suffer incalculable damage if we thought that, that we keep getting repeated infections. I don't think that that's a scenario we should really hope for or plan for at all. We should be using the vaccines to full effect, and that's where, I would respectfully disagree with Dr. Velumani on that particular point. Now, on the vaccines, our current production capacity in India is just over 2 million vaccines. So this also includes the commitments made to other countries. At a rate of 2 million doses produced per day, it will take 2.5 years to cover even a billion population, which is only about 70% of the population. So we will have to ramp up vaccine production from where it is right now. The US and India have announced this Quad initiative to put out 1 billion vaccines starting from September. That will help a lot. I also think that the price caps on vaccines are probably not helpful. Let people who are able to pay, pay more, and let the vaccine manufacturers make more vaccines. As long as we have free vaccines for people who can afford them, let's get the vaccine capacity also up. But I firmly believe that vaccination is the only exit strategy from COVID. It is the only exit strategy. And we need to ramp up the vaccination. Today, we are not able to do that in Maharashtra or Delhi. Although the arguments made by the chief ministers are perfectly valid, simply because when you can only make 2 million vaccines a day, how can we sustain 3 million vaccines delivery, day after day? We just can't do that. We were able to do that in the early stage because we had a buildup of vaccines which had started in October, November itself. But we will run out of that stockpile pretty soon. And in fact, we probably already have. So that is going to put a major brake on the vaccination program. unless we really plan for upping that 2 million to something like 10 million per day or 20 million per day. That's the rate at which we need to vaccinate now.
Yeah, for that you're going to have to green light a lot of more vaccine candidates as well,
Yes.
which perhaps we could have sped up in the last few months. Dr. Garg, you want to come in on this point on where we can go from here to really speed things up?
Yeah, first of all, this question is very valid. India will not be needing only 2 vaccines. We still will need 4 to 5 vaccines, which may be on different platforms, and few we are going to expect soon. That is, one is of Zycovid, or then, we are talking of Johnson and Johnson. And then we will be looking at the Sputnik vaccine that will be available in very limited quantity, but then that will be there. So like that, we will have, different companies, because these 2 vaccines are not going to suffice for such a big population, which we are looking at. Even if we look at 80 crores to begin with, till the time the trials for children are complete. So that is where we need to look at in terms of numbers. But as far as your first question was concerned, that means whether we should go straight to 18 years of age and then start immunizing everyone, that is not the answer. Because I feel that when we immunize 18 years and above, you are going to leave a major chunk who is more comorbid, more receptive to infection, and mortality is going to be higher. Though now the current infections or the trend in last few days have shown that we are getting more severe infections in less than 40 as well. But you see, compared to 18, they are super spreaders. But then basically if we start with 18 and all, we will be missing this major chunk of between 30 to 50 years of age already. And what is the now recent trend, what we are seeing in our vaccination points, is that people are coming who are 45 years of age. They're also bringing their parents as well. So that is the change, you see. Otherwise we will miss them out. We have to wait for about 10 days or so, then we can go to the next phase, and then quickly go on by May 1st to the last round. But then 2 vaccines are not going to be sufficient. India is going to need at least 5 to 7 vaccines, that is it. And out of which 5 are expected, additional 5 vaccines are expected.
You need more. True, we have to speed that process up, of course, keeping all the safety parameters in mind. But the question is not just about age and susceptibility. It is people who are out there. So people who are frontline workers in a true sense. Now you have a rule, for example, in Maharashtra, where you have to either vaccinate or have negative RT-PCR tests for delivery personnel. If you're going to have everyone at home and expect online to take care of needs, then how is that valid when you're restricting vaccination? What about people in retail shops which have essential services like grocery stores or chemist stores? Don't they need to be vaccinated quicker? So we're going to have a more nuanced way out of this as we move ahead. Perhaps not just depend on more restrictions and hoping that this peters out on its own. This is a continuing discussion, but for now I want to thank my first set of guests who are speaking with us on this India Development Debate Special, where we're looking at the COVID-19 situation we face from every angle.